Good afternoon, my name's Chloe and I'm going to be your student nurse today. Can you please verify your name and date of birth for me?
Elise Carden, May 20th, 2006.
Okay, so I'm going to go ahead and provide patient privacy. I'm going to wash my hands, and before we begin anything, I'm going to make sure that I have an order from the doctor to do a gastrointestinal assessment as well as a genitourinary assessment as well. I'm also going to make sure that I have all my slides together, which is something to document my findings with, a pen to document with as well, and my stethoscope to auscultate with. Okay, so I'm going to go ahead and ask you a couple questions. Do you have any allergies?
No.
Are you currently taking any medications?
No.
Do you have any cultural beliefs or practices that you would like to try to incorporate today?
No.
And do you have any health goals that you would try to reach today as well?
No.
All right, and are you in any pain right now?
No.
Well, if you feel any pain or discomfort throughout this assessment, just let me know and we'll stop right away, okay?
Okay.
All right, so I'm also going to ask you a couple questions. They may be a little bit uncomfortable, but is that okay?
Yeah.
All right, so have you had any abdominal pain recently?
No.
How are your bowel movements? Like how many times do you go a day?
About normal.
About normal, like 2 to 3 times a day?
Yes.
Okay. Any changes in your bowel movements?
No.
Any difficulty urinating?
No.
Any back pain?
No.
Any abnormal genital discharge?
No.
And how is your sexual health?
I'm not sexually active.
Okay. And before we begin, I'm going to make sure the client voids, and we're going to look at the color. If there's any odor and the turbidity, the color should be a light yellowish color. There should be no odor, and the turbidity should be clear, okay? So I'm going to go ahead and position the client. If you'll just lay down for a minute, I'm going to position the client in a supine position, and you can scoot over actually for me because I'm going to be on the right side.
Okay.
And their knees are just going to be slightly flexed. All right, and are you ready to begin?
Yes.
All right, so we're going to go ahead and get started. I'm going to lift your shirt up. Is that okay? Okay. All right, I'll pull these down just a little bit. Okay, so the first thing that we're going to do is we're going to inspect the abdomen. We are going to be looking for at the size, the symmetry, and the contour. The size looks good in relation to the client's age and the client's height. Both sides of the abdomen are symmetrical, which is good. And if you'll just lift this arm up for me, like that. And we're going to look at the contour. I'm going to lift this up a little bit too. Pull this down just a little bit. We're going to look at the contour of the abdomen. The contour can range from anywhere from flat to rounded, and the patient's contour is flat, which is normal. I'm also going to be looking at the skin on the abdomen. I am looking for any lesions, scars, superficial veins, and hair distribution. The client has no hair on the stomach, which is awesome, which is great. I don't see any scars, any lesions, any deep superficial veins. The color of the skin looks good in relation to the rest of the client's skin as well. You can go ahead and put your arms up for me. All right, and I'm also going to look at any abnormal abdominal movements. Don't notice any of those, which is good. I'm also going to look at the umbilicus. I'm looking at the color, contour, and the skin around the umbilicus. So the color is good, nice smooth skin around the umbilicus. I don't see any signs of inflammation. The umbilicus is in the midline of the body, which is great as well. So no abnormalities there. All right, so now we are going to look for any bulges or any abdominal hernias. So do you know what a crunch is?
Yes.
All right, so you're going to do one of those for me, and you're going to hold it for just a couple seconds, okay? Ready? Go. All right, that's good. I didn't notice any bulges or any abdominal hernias, but if there was one present, we would measure the girth at the umbilicus with a tape measure and then palpate that area later. Next, we are going to auscultate for vowel sounds. Vowel sounds are best heard and most active after meals or 5 to 6 hours after a person eats. And we are going to be auscultating for multiple different vowel sounds. They can be normal, which is every 5 to 15 seconds. They can be hyperactive, which is like a loud, high-pitched sound, and that is every 2 to 3 seconds or more than 30 times per minute. Those occur in increased motility. We also have hypoactive vowel sounds, which can occur after abdominal surgery or when the patient has peritonitis. They are fewer than 5 sounds per minute, I believe, and then there are also absent vowel sounds, which is highly uncommon, but to actually state that there is no bowel sounds or absent bowel sounds, you have to listen for a full 5 minutes. So we're going to go ahead and auscultate, and we're going to start in the right lower quadrant and work our way clockwise. I'm going to pull these down just a little bit. Right upper quadrant. Left upper quadrant. And then the left lower quadrant. All right, her bowel sounds were normal, which is good. Now I'm going to be listening for any bruits. We are going to be listening at the aorta, renal, iliac artery, and the femoral artery. And normally you should not hear any bruits. We are also going to be listening with the bell of my stethoscope since they are a softer sound. We're going to start at the aorta. We're going to move on to renal. Iliac artery. And the femoral. Let's have a look. Alright, so there was no evidence of any bruits, which is good. Now we are going to move on to percussion. Right. Just a little bit. All right, so we're going to start in the right upper quadrant. If normally when, okay, we're going to go ahead and start. So I'm going to go ahead and start, okay? Normally it's like a dull sound. It's more hollow over bone. All right, everything looked good there. Now we are going to move on to palpation. When you are palpating, if the patient states they are having any pain in any of the areas that you are palpating, you would stop and you would do those last. Also, deep palpation for like organs or masses is usually done by a practitioner. So we're going to go ahead and start. If this hurts, just let me know, okay? We're going to start in the, let's see, right upper quadrant. No, right lower quadrant. Okay. I'm going to go ahead and start in a circular motion. Does that hurt? All right, so patient stated no pain, and there was no evidence of any rebound tenderness, which is good. Now we are going to go ahead and palpate the liver. I'm going to place my left hand under the client's back at the lower ribs, and then my right hand is going to go at the mid-clavicular line and parallel to the costal margin. And go ahead and inhale for me, take a deep breath, and then exhale. All right, did that hurt? All right, there was no evidence of any masses or any bumps on the liver. Now I'm going to go ahead and palpate the spleen. All right, take a deep breath in and exhale. And did that hurt anywhere? No. All right, so there was no evidence of any masses or any bumps on the patient's spleen as well. So go ahead and sit up for me. All right, did you have any pain from anything that we did today? No. All right, so that's going to go ahead and conclude our assessment. This is your call light, so if you have any questions, just go ahead and ring that, and then I will come right away, okay? Okay. All right, can I get you anything else? No. All right, well, thank you so much.